Nancy with the hospice care plan and getting on to feeding. Again, let's talk about the types of food that a patient should be fed when they're in hospice care. Of course, as we said to begin with, it is the food that the patient wants to eat, but we have to be very careful about the texture of that food. Actually, what is the hardest food to swallow is water. I think that's always very surprising for most people because we think of water as being so fluid that it would be easy to swallow. And yet, the reason it is hard to swallow is that it is so fast moving. It goes over the tongue and into the palate, into the throat very quickly. And remember, we said that the tongue is the muscle that allows for swallowing. And if it is slightly sluggish, then you give someone a big drink of water and it goes over the tongue and into the trachea and into the lungs before they've been able to swallow it. It can cause pretty severe choking. So we want to really consider the thickness of the fluids and foods that we give patients. Consider milkshakes, smoothies, something that has a little bit of thickness to it. A nectar thick juice would be like apricot juice. We want to sometimes add an artificial thickener, which is kind of like cornstarch, but they're over the counter. You add them to the thin fluid, such as water or juice, so that they are thickened and they will slow their transit down over the tongue. Again, remember, hard foods, steak, things that are very difficult to chew, not good choices at this point. Remember, you want to err on what is able to be swallowed safely and that the patient wants to eat. Thanks for listening, and go to our YouTube site, The Care Plan, for more videos. Thank you.